Hi, folks, my name is Walt Gangle. I'm with the Knights of Columbus and also a member of the Duxbury Facts, as several other members here are. And thank you all for coming today. We always start our meetings with a prayer or a moment of reflection, so I'd like to ask our Grand Knight, our leader, Jay Monahan, just to say a prayer for us, for our accomplishing this today.
Thank you. I represent the Knights of Columbus for Holy Family Church in Duxbury. We are a faith-based program. We have a lot of different types of programs here today, but we try to start with a prayer. And if you would like to join us, please bow your head as we pray. Heavenly Father, we come together today from a vast diversity of backgrounds and responsibilities. We ask that you shower us with your grace that will sustain us in our efforts to heal the divide that separates us from you and from each other as we do our own parts to eradicate the scourge of substance abuse. Please keep us strong and hopeful, because the fight will be long and sometimes discouraging. We ask you to bless us and guide us and teach us to be merciful to all those in need of our mercy. Amen.
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 Well, thank you again for coming. And the purpose of this meeting is to introduce the Friends Know That Friends Die program. And this started with the, we were inspired by Tamika Perry. She's really the godmother of this program. And we worked with Senator O'Connor as well on the issue of education about the Good Samaritan law. We've got copies of the release from the police and the Knights here for people to pick up. We've got copies, we've got packets of the cards you can take. We've got other resources. We've got the Good Samaritan law, which is in place and been in place in the state of Massachusetts, that protects people from prosecution if they stay and help an overdose victim. And so we've got copies of the cards and some other resources. The objectives behind the card are to help the people understand that the issue of overdose abandonment and the toll in human life that's taken, and how by accepting personal responsibility and staying with the overdose victims that they can make a difference. And actually, it's in their own interest. We want to promote understanding of the Good Samaritan law. And you've got the public service announcement here that's been put together by the local chiefs in Plymouth County about the Good Samaritan law, to try to emphasize that, better understand that. And then overarching principle of promoting personal responsibility in dealing with their friends and neighbors and in substance abuse. It's an important message that's been missing. So since we've only begun to launch this, but we've already been contacted by other communities about the cards. This is a product of dealing with the police department here, the EMS department, under the fire department, the schools. We worked together, collaborated to produce the text of the cards. You'll see it talks about the Good Samaritan law on both sides of the cards, talks them through how to recognize an overdose and what to do. Stay with a friend, call 911, help them, and so that's what we've built from there. Now we're being asked to produce in a poster size for the schools, and we're working to get the production ready of those documents. Meanwhile, the press release has the contact information at the police department here. Chief has volunteered a staff member to take the field to request for the documents. It's a simple and direct message that's easily understood, and a physician from Brockton who called says it really resonates with the young. So we're working on getting the production ready, and meanwhile we're fielding requests. We've got a number of speakers that we're going to be talking today. I'm just going to introduce them generally. First off, we've got my good friend Karen Wong from the Duxbury Facts. Facts is an organization sponsored by South Shore Hospital. There are other Facts organizations throughout the South Shore. We've got, of course, Representative Cutler And Senator O'Connor, at his request, we several nights went and testified before the legislature in January. We've got Chief Clancy from Pembroke, Chief Allen from East Bridgewater, Tamika Perry, our good friend and Duxbury Facts member, Chief Bordieri from Plymouth, Assistant District Attorney Joe Janizek. He heads the gang unit for Plymouth County under the District Attorney, and of course Joe McDonald, our sheriff, who's been of such great support in this process and is going to help us with the printing of these cards. So I'll start with Karen Wong from Duxbury Facts.
Thanks, Walt. Good afternoon. I'm the coordinator of Duxbury Facts. Families, Adolescents, and Communities Together Against Substances. We're under the umbrella of South Shore Facts. I'm just so moved by this whole event and this gathering of really cutting-edge folks that the country should look to this model that's going on in Plymouth County to really save lives, save families. Very quickly, Duxbury Facts really has, its mission really is to reduce substance use and to promote and enhance mental wellness. We do that through promotion, education, prevention education, and we do it through intervention. I want to keep things very pithy, and Walt asked me to say, how does Duxbury Facts, some of the program we've done this year, intersect with the Friends Don't Let Friends Die cards. And really what comes to mind is a program that we had about a month ago, If They Had Known. It's the Clay Soper story. It's a story about a young man in Winchester who passed away after mixing alcohol and prescription drugs. His friends didn't abandon him in the true sense that we think of, where kids are worried that they're going to get in trouble with law enforcement or with their school. They left him, they tucked him in bed and thought that he could sleep it off. That's another form of abandonment. An hour later they checked on him and it was too late. So these Friends That Don't Let Friends Die cards provide really valuable education on what to do if a friend is in active overdose, and also promotes the Good Samaritan law, saying you're not going to get in trouble. It's an awesome card, and I hope that it gets picked up around the country, around the Commonwealth. So thank you for doing this, Walt. Thank you.
Good morning. I'm Matt Clancy, and I'm the police chief here in Duxbury, although I would like to find out what the benefit package is in Pembroke. I am not going to let that one down.
My mother-in-law is from Pembroke.
Fine community.
Again, I'd like to thank you all for being here at the Duxbury Police Headquarters. We're thrilled to have you, and we're thrilled to be able to host the event today. You know, as we're all too painfully aware, our local towns and the entire Commonwealth, we continue to battle with the greatest public health crisis in history, at least in my recollection. And that's the form of the opiate addiction crisis. You know, look at the collages here that really put faces to what is happening here. Nothing, nothing in my history in law enforcement that comes even close to what we're dealing with here and now. But with that tremendous suffering and that loss, it's being met by an inspiring call to action, emerging partnerships. It's between survivors, citizens groups, public safety, the healthcare industry, and government leaders. Today's event's an obvious example of how people from all corners of the community have united to fight the battle. Civic groups like the Knights of Columbus and Duxbury Facts are stepping up throughout Plymouth County and throughout the Commonwealth with caring and compassion for those that are struggling with this opiate addiction, for those in crisis and for the families that are desperate for information and desperate for help. Today, through the leadership of the Knights, we once again pulled together to tackle sort of an important component of our overall strategy to fight this epidemic. While the Good Samaritan law here in Massachusetts was actually modified in 2007 to insulate overdose victims or those that are reporting the overdose to public safety, we're still encountering tragic deaths because these overdoses aren't getting reported and emergency medical care is not being summoned in an immediate fashion. And it's not being summoned because in many cases there's an unwarranted fear that police involvement is going to result in some type of a negative consequence, a criminal action. So we need to do a better job of providing the awareness of what the Good Samaritan law truly does. Those folks are insulated from criminal charges. They need to make that phone call. I suggest that many of these deaths that we've encountered through abandonment probably could have been prevented had early intervention, early initiation of emergency medical services was in play. So this campaign, it wisely seeks to create that greater awareness of the protections provided under the Good Samaritan Act. And it's providing a critical message that looking for everyone to really join us in fostering greater awareness. Plymouth County, we're very fortunate here. We're the home to a program known as PCO, Plymouth County Outreach. It's a multidiscipline program that's truly a national model. You're going to hear a little bit about that in a second. And early, if you had the opportunity, it's scrolling now. The PSA, we had the volume up a little earlier. That was a collaboration with PCO and some other organizations just a couple of years ago on this very issue. And it has garnered some positive results, as I just learned earlier today, but there's more that can be done. Thus, what we're doing here today, the development of this new campaign, Friends Don't Let Friends Die. It reinforces that need for continued greater awareness of that Good Samaritan law. And just lastly, I wanted to recognize some members of my Duxbury Police crisis intervention team. And in my policing career, and it's now starting my 35th year, I can say without reservation that the development of this unit has been some of the most important work that we, the local police, have done in the area of public service. And many police departments have created these types of units. I find the work of these, in our case, these men, soon to be joined. We're going to be expanding, and hopefully we will get some of the ladies of the PD involved in the program. But I'm blessed, truly blessed to command a committed, community-oriented police department as a whole. Community policing is inherent in what these folks do, and it comes natural.
To the homes of overdose victims. During these visits, individuals and families are provided with resources and support.
They are also given assistance.
Good job, Cam. But I will say that with regard to these folks that's doing this crisis intervention work, truly, I'm at awe on occasion at looking at the level of caring and compassion and the drive that these officers have. These are, here in all the communities that are doing this through PCO, these are the boots on the ground that are living this 24/7, 365. And I never in a million years would have seen the police service taking this type of involvement. And it was, completely necessary. And I couldn't be prouder of the work that gets done here and throughout Plymouth County with regard to that. They're making a difference. Sergeant Homestead and Officer Kane are two members of the unit. Thanks for coming, guys. The work they do every day with families is tremendous, and the relationships that have been developed. We talked about the stigma in some of the conversations we had earlier when we were meeting out back, and stigma continues to be an issue, but boy, we've made a tremendous difference as a community, because it's when folks are calling the police station, families or people that are in crisis themselves, calling us and asking, hey, can I talk to somebody? Wow, have things changed. Just a tremendous effort. But it's a credit to all the partners in the room here, all the organizations. It's our public safety partners with EMS and the fire service. They're the ones that are doing the work when the bell rings to give these folks a chance to get themselves to, hopefully, at some point, to sort of a meaningful recovery. So, with that, I just want to say thank you all. Please, let's all spread the word good and wide that friends don't let friends die. Thank you. I'd like quickly to introduce to you, these are the sort of the founders, if you will, of Plymouth County Outreach. Chief Mike Butteri from the Plymouth Police Department and Chief Scott Allen from the East Bridgewater Police. Gentlemen.
Should I go first, Chief? Always do. I want to thank you for inviting us, Matt, to talk a little bit about this. This overdose abandonment fits right in within what we do on a daily basis in Plymouth County. What I want to do is briefly, if I can do briefly, give you a little bit of an evolution of where we're at today and kind of focus on what happens in the county. We knew years ago, a few years back, we saw this problem. Every town was having the same type issue. We knew it wasn't within each town. If someone overdosed, we needed to make this connection. And through our county task force and our county partner, Sheriff McDonald and DA Tim Cruz, we were able to come up with a task force so we could combat this in a more of a county initiative, okay? So it evolved through many partnerships. The success of the program lies, and I think Matt mentioned it, in the collaboration piece, the partnership piece, and through partnership we create relationships, and through relationships things get done. You all know how that is. When you get a call from someone you know, things get done. So we're able to put people into beds very easily. So what happens in our program, and I think what's right in line with the overdose abandonment and encouraging people to call 911 is the stigma piece that Matt mentioned. We in our program recognize that stigma and an intervention period of 24 to 48 hours are two key components of how we can help. We have what we call a front row seat to the problem in Plymouth County. As police officers, we go on every overdose, but we realize that there's a portion of people that go directly to the hospital. Our data that we look at shows that we are increasing the number of people that call 911, and we want to encourage that. We don't want to be an obstacle. We shouldn't be. Policing's changed. The philosophy of policing's changed. I know in Plymouth County, I think throughout the Commonwealth, and hopefully through the country, 21st century policing is community policing. Trust and engagement in the community. We want to be that partner. So we don't want people hesitating to call 911 in any way. So publicizing the Good Samaritan law, explaining that you won't be held responsible legally in any way, and the whole point of trying to help your friend. When your friend is down, a lot of times they might think they're going to be okay, like was mentioned, or the fact that you're worried about law enforcement engagement, or there's the stigma. And unfortunately, people die every day because of stigma. People are embarrassed or afraid to call for help. So we don't want that to happen. These cards are a phenomenal idea. We were talking earlier, we're going to put these in all of our packets. When we go on an overdose follow-up, we leave a packet of information for loved ones to utilize for resources. And we want to make sure this is in there as well. So Chief Allen represents the northern part of the county. We have a northern and south group, so let's talk a little about what he's seeing.
Thank you. And I'll be brief as well. First of all, kudos to Duxbury Facts, Chief Clancy. I mean, this is leadership at its finest. The one great thing that we've been able to do as a county is work together, and it's through the leadership of the DA and the sheriff, through the drug task force, and then all of those partnerships that Chief Butteri talked about. It's neat to see on a daily basis. We have people in recovery going, knocking on doors with police officers in plain clothes, offering a helping hand. And that's something we just want to continually, spread that message. And I think it comes down to messaging. It's just getting that word out there. Coincidentally enough, this morning, Plymouth County Outreach, we just put on an alert because over the last 8 days, we've had a big spike in overdoses. We've had 53 overdoses throughout the county with 6 fatalities. With all the great work that's going on, we still have yeoman's work and effort to move forward. So, we just want to continually spread that message. In our release, we highlighted that Good Samaritan law that included the sheriff and the DA alongside the chiefs here in Plymouth County, because that is so critically important to report those overdoses. Because we know Narcan works. in our last year's data, 2017, 95% of the time when Narcan was deployed, a life was saved. So we're going to continually push that message, and again, thank you, and it's a credit to the Duxbury Police Department of the town for the efforts that you've done. Thank you.
And I'd like to ask Tamika Perry if you don't mind coming up, and she'll tell her personal story and put a face to all these issues, that all these lovely lives that have been lost here.
I just want to thank the Knights and Walt for the cards and for helping me, my Fax family. I want to thank them, Senator O'Connor, Rep. Cutler, my moms out there. This story it's a personal story to me and my son that I felt that needs to be told. So bear with me, please. On May 4th, 2016, I lost my son Kai at the young age of 20. Kai was a graduate of Duxbury High School and went on to attend Curry College, where he studied psychology. Kai was known for his infectious smile, athletic ability, dry sense of humor, dry sense of humor, love for his family and friends, kindness and compassion for others. He was loved by so many and made an impact on others in a short life. No one ever wakes up and thinks they're going to be an addict. My son was not without flaw, but he had dreams and goals and aspirations and wanted a bright future. But on the morning of May 4th, my life changed forever. My worst fear came true, and I felt the life leave my body. I was notified that my son had passed. I immediately went to the apartment complex where Kai was found. I was told by residents of the apartment, who were also estranged family members, step-family members, that he had stopped by the previous night with some friends, but left. This was later to be found untrue. And the reason why I tell this is because it's so relatable to the Good Samaritan law and what should have been done and wasn't. This was later to be found untrue. Kai, in fact, was with a friend and spent the night in the apartment where he was also given opiates even after he was already on other substances. It was later determined that Kai did indeed overdose in the home and not outside. As to what time is unclear, as he was in full rigor mortis by the time the police and EMS had arrived. I don't know whether my son would have been able to have been saved or if it was already too late for him. But I will always wonder what if different decisions or actions had been made, would the outcome have been differently? It was also rumored that a week earlier a girl had been put outside from the same apartment. I don't blame anyone for the choices my son made that night to use. Those were his choices. Like so many others, our children feel that they're invincible and nothing will ever happen to them. But tragically, we know this isn't true. I'm sure my son felt safe being around family and friends. Just because people should do the right thing doesn't mean that they will, whether it be for self-preservation or out of fear. After the loss of my son, I knew I had to do something. We are losing a whole generation. As a country, we should be outraged. Here's what I learned about overdose abandonment. It happens all the time. No statistics are kept. It's frustrating for families, EMS, and police. The Good Samaritan law was passed in Massachusetts in 2007, yet in 2018, people are still being left to die. Parents are burying their children. Grandparents are being left to raise their grandchildren. People need to know about the Good Samaritan law because thousands of lives could be saved. I reached out to Senator O'Connor for help to address the lack of information and education about the Good Samaritan law and the opioid epidemic. He and Rep. Cutler have been very supportive. The Knights of Columbus stepped up to help with the legislation and education. Instead of waiting for the government to require education, it's great to go public with these cards. I hope people across the state and country, for that matter, adopt and use them so that fewer lives are lost to overdose abandonment. I hope all schoolers, young adults will keep these cards in their wallets or purses to use in an emergency, especially as graduations and celebrations will be taking place. I hope that parents will keep a copy to refer to as well, help ensure that their children keep them. It is very important to get these cards out to those that are actively using as a reminder to call for help. We as parents and community members need to continue to advocate for change, education, prevention, treatment, and end the stigma and shame regarding substance abuse. We want to encourage people to make better decisions and save lives. We are our brothers and sisters keepers. If you see someone overdosing or having a medical emergency, call for help. Don't run, call 911. And those who choose not to do the right thing should be held accountable. I don't know if I will ever get justice or even any closure for the tragic loss of my son, but I will continue to fight and be his voice. Kai Perry's story isn't over. Thank you.
Thank you, Tanika. I know that's not easy. Next, I want to ask Sheriff Joe McDonald, and a couple of us from the Knights and the Duxbury Facts went to the annual conference that he and District Attorney Cruz host annually, and it was a tremendous effort, and it was a great learning experience. We learned a lot, and we met a lot of people from other organizations that are working on these issues. And it's a great thing that they started to, the sheriff and the DA have started to do. So I wanted to commend them for that. And I want to introduce our Sheriff, Joe McDonald.
Thank you, Walt. Thank you, Chief Clancy, for inviting me to be part of this important meeting that you're holding this morning. As Walt said, my name is Joe McDonald. I'm the Sheriff of Plymouth County. And I see that I was asked here to talk about the magnitude of the overdose problem here in Plymouth County. Let me say very simply that it would be impossible for me to overstate the magnitude of the drug problem in general and the overdose problem specifically. Where do I begin? I've been the sheriff here in Plymouth County for 13 years. Before that, I spent many years as an assistant district attorney. I prosecuted cases here in Plymouth County on a daily basis, and I thought at that time that I had a pretty good handle on what the drug issues were, what the crime issues were in general here in Plymouth County. And as I have gotten older, as I have gotten into the office of sheriff and seen things from a slightly different perspective, I realized that what I had thought I knew, and maybe I did know at that time, was only part of what the real problem was. It's a death issue for those that we lose, and a quality of life issue for those of us who survive, who miss those loved ones that we've lost. As I stated, I cannot overstate the magnitude of the drug problem that we have, not just here in Plymouth County, but nationally. I used to think that I could quantify the number of individuals. You can quantify, as difficult as it is, the numbers of individuals who are injured or pass away as a result of drug use or drug overdoses. You can quantify the number of cases in a day that are prosecuted or people are incarcerated for the possession of drugs or the manufacture of drugs or the distribution of drugs. All those things can be quantified. But there's a whole part, like an iceberg, that underneath that you just can't see, that exists. When I talk to the experts on drug addiction issues, and I'm not talking about the PhDs or the LICSWs or the MDs, the experts that I get to talk to on a daily basis are serving time at a correctional facility down on Overy Street. When I talk to them, they make it very clear to me that I was only seeing a part, less than half of what that picture is. And think about this in our own lives. Individuals who are serving sentences for committing crimes of violence, domestic violence, violence on the streets, people who are serving time for theft, People who are doing things, committing awful crimes, that we know but for the fact that they are either under the influence of drugs or acting to try and get money to pay for those drugs. These people would never, ever commit those acts. But when they're under the influence of those drugs, it's almost as though free will is gone. So when you think about the drug issue in general, not simply the overdose issue, but that's something that also we must not lose sight of, it is far larger, and as I said, cannot be overstated. Because for every person that is incarcerated for a drug crime, I used to think I could quantify that. People would ask me how many. And I am very careful now how I answer that question when people ask how many people are serving sentences in a correctional facility as a result of drug crime. And I hesitate to quantify it, but I will say this. The number of people that are serving those sentences for drug-related crimes are the vast majority of people serving sentences. It's a quality of life issue for our entire community. I want to thank you for sharing, Tamika, your personal story. Those are the stories that need to be heard. And people like Tamika can speak to this issue in a way that, thank God, many of us cannot. But as human beings, we can feel the grief that those families go through. And pray to God every day that we don't go through those. And although I am blessed not to have such a personal story, I will share one 4 weeks ago. My dearest friend in the world, who lives in the city of Taunton, called me one night, which is not unusual. In my telephone conversation with him, I knew as soon as he said hello to me, something was off. And he informed me that he had lost his, this is 4 weeks ago, he had lost his 41-year-old daughter, who left behind a husband and 3 teenage children. And he was really at a loss. He got through it, and I'm hoping that he'll be able to make something positive of this. But the reason that I bring it up is because it made me think about the Good Samaritan law and how the individuals that she was with that night did not know, because emergency medical services were not called for a period of 2 hours. And I don't know what would have happened had someone called sooner. But the reason that people did not call is they were afraid of prosecution, the consequences. Now, I can't think of a worse consequence than losing one's daughter, or one's son, or one's any family member, or a friend. I can't fathom that, but certainly when I met Walt at the conference, I knew at that point in time that our paths crossed for a reason. And it's so important, and I'm so glad to be part of what's going on here today, to let people know that the most important thing we can do when you see something like that going on is to notify emergency services. They do amazing things with naloxone. Lives are being saved. And I'm hoping, and I know, I shouldn't say I do hope, but I do know also, that the more people we can talk to and let know, the most important thing when you see someone overdosing on drugs is to call emergency services. Lives depend on it. And sometimes the lives that are most profoundly affected, we see the beautiful people in front of me here. And I looked as I came in and I saw their lives mattered. But I would suggest to you this from here, that their lives still matter to those of us who knew them, those of us who love them and still do, and those of us who in their names are going to go forward and let other people know that this should never happen again. So I thank you all for coming. I thank you all for spreading the word. And I thank you for giving us the opportunity to be part of this program. Thank you all.
Thank you very much, Joe. And the Sheriff's Department's going to be helping us with the printing of this going forward, and hopefully look a lot more professional. I think we did a pretty good job so far, but it's been a back of the envelope kind of production of these documents. But we're getting calls from Plymouth, from Brockton, et cetera, for the cards, and we'll need some help to get them all out. Assistant District Attorney Joe Janizek is here on behalf of DA Cruz, and I'd like him to say a few words about the Good Samaritan Law. Thank you very much.
And thank you, Walter, on behalf of DA Cruz. Although we take it very much for granted here in Plymouth County, I can tell you that it is not commonplace to look around and see the partnerships that we have and the strength of the commitment to a common cause. And we are, in the Plymouth DA's office, extremely proud to be a part of that partnership. Shared responsibility and shared commitment to avoiding, frankly, a story like Tamika's. So I spoke with Tamika coming up on 2 years ago for the first time on the phone. I can tell you that at the DA's office, I assigned a prosecutor to take a look at the circumstances of her son's death, looking at all of the circumstances around why it happened, how it happened, who was there. These are the things that we look at in law enforcement. We want to figure out how to avoid this again, because one story like this is too much. Okay? And Walter has asked us here to talk about the Good Samaritan Law and to clarify for folks that we don't prosecute people for doing the human thing. Okay? And that's what we're here about today. We don't prosecute people for doing the right thing. And that is calling 911. That is picking up the phone, getting these first responders there. This isn't an instantaneous thing. This can happen over the course of several hours, okay? So you need to call because, like the chief said, we have a window of time, and if you can administer that Narcan, these gentlemen in the back do it very well. We see thousands, literally thousands of lives being saved from that administration of Narcan. And all it takes is for one person to do the human thing, okay? So this campaign, Walter, is extremely important because what do? You're in that situation for the first time, you don't know what to do and you panic, right? This puts somebody in the mindset of what you do before it happens. It gets that information in front of people so that they know. They're not going to be prosecuted. They're not going to be arrested. They're not going to be further stigmatized. They're going to do the right thing. So let me first say that and make that very clear. You will not be prosecuted for doing the human thing, for possessing drugs, for using drugs. Okay. The back end of this, though, Walter and I were having a discussion before we started, is if you do the wrong thing, you may very well be prosecuted. And we are going to do everything we can as law enforcement to investigate exactly what happened. Because if you contributed to that death, as a dealer, we just had a dealer prosecuted, one of the few in Massachusetts, and the longest sentence for a dealer giving a fatal dose to an individual, 6 to 8 years. We prosecuted that dealer. We treated Miss Perry's case as well as every other case that we get of an overdose death in the county as a homicide scene. Our troopers go out there and they treat it essentially as a homicide scene. They document it, they seize cell phones, they look at how this happened. Why? To prevent another story like ours. So on the back end, we talked about Penn State and doing the wrong thing, ignoring things. You can't do it. You can't do it. So let that word go out as well. The DA's role has shifted, as the chiefs have said, and we have a tremendous partnership with the sheriffs, with Sheriff McDonald, with Chief Lettieri, with Chief Allen, all of the chiefs, 27 different departments in the county, okay? Rep. Cutler, Senator O'Connor, Duxbury facts, all the facts around the community. Don't take it for granted. It is working. It is working, and it works, and it is not ego-driven. It is results-driven, and that is huge. And we all should be very proud of that. And I would leave you with this. Tamika said something very poignant. Just because you should doesn't mean you will. Okay? Let's hope that this today changes that a little bit. Let's hope that this today has some folks that who in the past should have. Let's hope it dictates that they will next time. Okay? Thank you all very much on behalf of the DA team.
Good afternoon, everybody. My name is Representative Josh Cutler. I'm joined by Senator Patrick O'Connor. And I'll just say a few words and I'll let Pat take it over. Our jobs relative to all of you are the easy ones. As I say, our job is to change the law, but changing attitudes is a much more difficult task. And we've been successful in doing that because of the great partnership that we've seen with law enforcement, local community groups like Duxbury Facts, the Knights of Columbus. Thank you, Walt, for putting this event together, and you and your team. This is terrific. And really driving that, though, are the personal stories of folks like hearing about Kai, hearing about, I just unfortunately had a Pembroke dad in my office on Wednesday up at the State House testifying on a bill that we filed having to do with this very topic. And he lost his son, Stephen, who was 20 years old, who was released from a drug treatment facility. And we don't know the details of Stephen's death, whether or not this card may have helped if someone had been there, but certainly I like to think that it might have helped, and that if we can continue to tell these stories like Kai, like Stephen, we can prevent that future tragedy from happening. So I want to thank all of you for coming out here today, for helping us to tell these stories. I want to thank especially the Knights of Columbus for putting this card together and the work that you've done to help promote it and build awareness. I know I'm going to go back and take this to my colleagues in the House, and I know Senator O'Connor will as well in the Senate, and share this, and hopefully we can spread this message and again, to help save some lives. So thank you all so much for joining me. I know my good colleague here, Senator O'Connor, wants to offer a few words as well.
Thank you, everybody, for the opportunity to be here today. This has been an issue with the opiate overdose issue has been something that I know myself and Representative Cutler and all of you have been tragically impacted by and trying to work to improve for well over a decade now. And at the state level, we have seen two pieces of legislation go through. The first one was the STEP Act from Governor Baker in 2015, which has become a national model now of how to first start addressing the opiate crisis on a statewide level, creating the state without stigma, creating more of a partnership with hospitals and healthcare professionals and law enforcement. And now we have the CARE Act, which is the second phase of what the governor is trying to do and trying to continue to be the national model of how to now curb the epidemic. And what we've seen after years of double-digit overdose increases with deaths, we've actually seen in 2017 for the first time a decline. And that is because of the hard work of people like Karen Wong. It's the hard work of people like Walt and Jay, the hard work of people like our law enforcement, our legislators, and but most especially, the hard work of those individuals who are directly impacted by this epidemic, such as Tamika Perry. And thank you for sharing your story, Tamika. I got sworn into office on May 18th, which was 2 weeks after Kai passed away. And one of the first emails that came into my email box was from Tamika. And one of the first meetings that I had was with Tamika. And when she told me the story of Kai and the general overdose abandonment issue that we have here in the Commonwealth of Massachusetts, I wasn't aware of it. And when you look into the statistics that aren't necessarily that readily available either, but when you look into the faces of the pictures that are down there, and you see the impact that this has had across the Commonwealth, we decided together to file a piece of legislation that would cover two bases. One would be just a mandatory assembly for every single school in the Commonwealth of Massachusetts at the high school level to make aware of individuals, make aware the dangers of substance misuse. And the second was to highlight the Good Samaritan law, to make sure that that was a key component of this assembly. To make sure at a young age, what we put in to our children's heads is that call 911. No matter the scenario, no matter what you think may happen to you, call 911. As if it was anything else. And we hope that as the CARE Act continues to make its way through the legislature, that we will add that as an amendment in the House and in the Senate, and that will become law in the Commonwealth of Massachusetts. We truly, truly believe that it will too, Mika. And one last story as we're here gathering. The CARE Act's public hearing took place in the Gardner Auditorium a few months back, and the hearing lasted approximately 11 hours. And one of the last speakers were Jay and Walt to highlight their Friends Don't Let Friends Die initiative, as well as all the other work that the Knights of Columbus were doing. They sat in that auditorium for 11 hours to get their word out to that committee that this is something that needs to be included in that bill. So Jay and Walt, thank you for all of your hard work. Thank you.
If there's any questions from members of the media for any of our speakers, would now be the time to raise them. Any other questions that people have of our speakers?
I don't have a question. I just want to thank everybody for anything that you're doing, anything. I mean, I could go further into but it's not about me. It's about, and when you look at it like that, it happened to us. But until that happens, people aren't gonna. They're not. But they need it. They need to think, like she said, it could happen to anybody, rich, short, tall, small, and it just irritates me, you know. And I'm an addict, and I'm not ashamed to say that. So that right there, I had to release. It's nobody's business, but I made it my business to say it, because right now, when she was talking, I just get angry, and I was telling her dad, and then I'll be quiet on the way here, that me as the kind of person I am, I don't care if you're going to arrest me. I'm not going to sit there and let somebody die. How do you live with this? I can't fathom it. And I've been here 61 years, and if I did it again, but I appreciate all of you people, especially that child I brought in this world.
Thank you very much.
Thank you.
Well, I hope everyone, we've got copies of the cards, packages of the cards, and other related materials available. The Good Samaritan Law, the bill that was introduced by the Senator, and thank you very much. And officers will get you copies of the cards, and we'll get you all copies of. We've got boxes of cards of my car, and we're happy to share them. So, thank you all very much.